Thank you so much, Nika. That was a great introduction and overview of what we're trying to accomplish today. This is a really exciting moment to look at the role of business in creating and generating population health. We have seen in the last, I would say, 5, 6, 7, 8 years, a huge growth in the interest on the part of the business community in health, not just within the four walls of their office setting, but extending beyond that to the families of their employees and then even further to the communities in which they operate. So we see a lot of interest, but I think this is still a new field, and the question of how that kind of change gets implemented is still under construction. So one of the great attributes, in my opinion, of this roundtable is that it really does bring together experts from multiple sectors. So we have business leaders, we have public health experts, we have academics, we have advocates. And today we have the opportunity to have what I hope will be a very fruitful exchange of ideas, but not just ideas, also practical strategies for how businesses that are taking on this question are beginning to approach an engagement with the community that is not necessarily in their history or wheelhouse, as some would say. So we have a lot to learn from some of the experts who we've gathered here today together, and I very much look forward to the conversation. Thank you all for being here. So let me just quickly introduce them. You have a longer bio for each of them in your packet, and I will be brief as a result. Ralph Schultz is the president and CEO of the Nashville Chamber of Commerce, where he's been since November of 2006. And during his tenure, the Chamber has played a key role in helping the region emerge from the recession of 2007 into a period of unprecedented growth. He has worked collaboratively with a number of players on the ground, and we very much look forward to hearing from him. Second on our panel is Alex Chan, who's the Director of National Health for the Clinton Health Matters Initiative, where he's focused on chronic disease prevention and treatment. And finally, Derek Yak is the Global Chief Health Officer for Vitality. Many of you may be familiar with his organization that has worked to promote collaboration across sectors for quite some time to improve health and reduce chronic disease. So why don't you all come up, and we will have a presentation from each of them and then a moderated discussion. It'll take about an hour, and so here we go.